Okay, good morning, everybody, or good afternoon, where Carly's at in Spain. We just wanted to welcome you to our hearing podcast today. Just kind of introduce ourselves, introduce what we're doing and what our goals are with this podcast. So I am Dr. Ruth Reisman, and this is my colleague, Carly Sygrove. So I'm going to just speak a little bit to what I do in the field of hearing and audiology, and then I will give the floor to Carly to speak to her experience as well. So I am currently an audiologist. I am the founder and co-owner of urbanhearing.com. And I am also a full-time university professor here in New York City, teaching about audiology and hearing to graduate students. I came into the field for multiple reasons. Mainly, I watched my mother suffer with hearing loss for many years. And then lo and behold, a few years into being an audiologist, I too lost my hearing. So it was interesting that Carly and I connected on that aspect, and she will talk about her experience and why we're here today.
Perfect. Thanks, Ruth. Thanks for the introduction. Hi, everybody. I'm Carly. So my story is a little bit different to Ruth's. So I had sudden hearing loss, and it was almost 7 years ago now. And that was in my left ear, and it left me profoundly deaf in that ear. So following that, I began blogging about my experience living with hearing loss. And through that, connected with lots of people all over the world. From my blog, I started my Facebook support group for people with hearing loss. And later I founded the Sudden Hearing Loss website, which is for anyone going through sudden hearing loss, to give them information, advice, support. I'm also a writer, and more recently became a hearing loss coach to support people with hearing issues and hearing loss, tinnitus, vestibular disorders, move forward with their lives positively and just live well with hearing loss. So that's a bit about me. I'm wondering, how did you get into the field, Ruth?
Yes, so that's great. And I guess the field in some ways kind of chose me. Like I said, I did see my mother suffer with hearing loss for many years. I remember she took me to the pediatrician, and the pediatrician looked at her and said, your daughter's going to be fine, but you're not going to be okay. Like, you need to get your hearing checked. You're obviously not. He noticed right away that she wasn't picking up what he was saying and that she wasn't communicating as well as she should have. So she, at the end of the day, got her hearing tested. She had something called otosclerosis, which is a overgrowth of the bones in the middle ear. So one day we will hopefully go into the anatomy and then discuss different types of hearing loss. But essentially it was progressive. So it started out maybe mild or moderate, but then eventually progressed to a pretty severe loss. That type of disorder is actually eligible for a surgery called a stapedectomy. But when you hear surgery, that's probably one of the hardest things, I'm sure, in the coaching, even when people have to go through surgery. Like, I know you're considering a cochlear implant, but that's one of the most challenging things for people to kind of get through when we're talking about hearing loss and the grieving process. So she had a lot of fears surrounding that. And she started out with hearing aids, which she had a lot of difficulty with, a lot of challenges with. So I kind of saw her struggle through all of those stages until she finally got to a point where things were just so significant that she went on and got the surgery. So that was kind of like my introduction to the field. And later on, I had a really close friend whose mother was an audiologist. And she invited me to her office to observe what she does. And I just thought the field was really interesting. It was a great blend of kind of like the healthcare aspect, but a lot of counseling and support, and really seeing that benefits of people struggling with whatever they're struggling with. If it's, hearing loss, like you said, tinnitus, vestibular disorders, maybe an auditory processing disorders, again, something that I look forward to delving into further, and really giving them the solution to improve their quality of life.
So a lot of your life actually built up to becoming an audiologist, and not just your mum, but actually having that experience observing and watching an audiologist at work.
Yeah. And then, like I said, later on, I, similar to you, suffered from a sudden hearing loss. Still unclear what the cause is, because I do from time to time have dizziness and the ringing in the ear comes back. So it seems like it was likely something consistent with Meniere's disease. I see a pattern, and we'll talk about that again, about different patterns and things that we can do to manage it. But that was a really interesting experience, because during that time period where I completely lost my hearing in my left ear as well, so we have that in common too, that I just really struggled. People thought I was ignoring them when they were talking to me on their left side, couldn't locate where sounds were coming from. So it really, in terms of safety, crossing the street, walking in the street, was very disorientating. And then the tinnitus obviously was one of the biggest things that I struggled with, because working as an audiologist, going into a pitch quiet booth and then hearing that crazy tinnitus roaring in my ear, I couldn't even hear the patients telling me their case history or telling me, the reason why they're in the visit. I literally had to step out and ask like one of my interns or residents to step in and take the case history, because I couldn't do it on my own. I don't know if you had that kind of experience with your hearing loss, or when you first experienced it, what were the challenges?
Yeah, I'm just thinking what an amazing background you have to be an audiologist, because you have that first-hand experience of understanding, for example, how much tinnitus can interfere with just conversation, or and how much hearing loss can affect everyday life. So that's quite an interesting aspect of your story. I think with me, with the way hearing loss affects my life, the way at the beginning, it was everything, because hearing is something that really enriches our lives and helps us interact with the world. And I think when some of that sense has gone, you have to learn again how to do everything. Think, like you said, so my left ear is completely deaf, so I have no idea where sound is coming from. So it's even down to silly little things, like somebody will call my name and say, "Hi, Carly," and I'll be like, I won't know where they're calling from, and so I'll be turning around, and then they'll say, "I'm over here." And over here means nothing to me. I don't know where that means, So it's just those little things, and finding my mobile phone when it's ringing, I can hear it somewhere. So my hearing ear is hearing it, but it doesn't know where it's coming from. So I can be walking around the house looking everywhere for it. So little things like that, but then big things like feeling safe in my surroundings. So when I first lost my hearing, I was living in Madrid, in Spain, and right in the city centre. And many times I'd go outside, and firstly, crossing a road was scary, because I didn't know when a car was approaching from my deaf side unless I was looking. So I constantly had to be looking to my deaf side. But then there's the noise of the city. So there's like the building noise, and there's the sounds of people and people busking, and just when you don't know where that's coming from, you find yourself using your eyes so much more and having to scan your surroundings. And, right at the beginning of all this, I felt very unsafe. And I felt like sometimes scared to go out on my own, just because I didn't feel comfortable in my surroundings. Nearly 7 years on now, I mean, it's normal, but this is just my life. It's part of who I am. I look to my left a lot of the time. I get used to not knowing where things are. I let things go over my head now. So if I hear something and I don't know where it is, I'm kind of like, okay, I don't know. Things are just normal now, but there's still difficulties. There's difficulties mainly in socializing. So being in a noisy environment and trying to hear somebody speaking to me amongst the background noise of music or lots of chatter, that kind of thing, it's really difficult, and it takes a lot of energy. And with more noise comes more tinnitus. So I'll be trying to have a conversation with somebody, my partner usually, in a restaurant, And as the noise gets louder, it becomes more difficult to talk. And then it becomes more difficult to talk as well because I have more tinnitus. So the tinnitus is louder and then I can't hear even more. And it's a cycle. Having lunch or dinner with a big group of people is almost impossible because I don't know whose voice is coming from where. I can't hear across the table. I won't know what somebody in one corner of the table is saying. So I generally just have a conversation with the person next to me when I'm in a big group. So things are very different now.
Yeah, I think so. You said something really interesting and similar, a lot of patients will say the same thing, like, it's just normal. Like I deal with it. It's so, we just kind of have to say, maybe it's not really so normal because you're still struggling or in different environments, but you've learned to adapt, so to speak. And that if there was something that can maybe make it better or improve your quality of life, that you would consider it, which I know, you kind of on that path, and we look forward to exploring that a little bit more. I guess, what were things that you found in the beginning as ways to help you compensate or manage with the challenges? What were the things that you found helpful in the beginning?
I always tell people, be kind to yourself because it's not easy. I wish somebody had said that to me at the beginning because I was hard on myself, I think. I look back and think that a lot of the time I give myself a hard time for not, I don't know, being able to hear somebody or worrying too much about crossing the road, things like this. I think the things that helped me, my partner helped me a lot because we went through this hearing loss together, really. So I told him about everything. Poor guy. Poor guy.
He sounds like a nice guy, though.
Yeah, he's great.
We'll get him on here one day to talk about the partner perspective.
We don't want to give his confidence too much of a boost here, but he was there through everything. So I was lucky enough to have him there to be able to explain to him the difficulties, because if you haven't had hearing loss and if you don't know what it's like to only have hearing in one ear, none of this you will have considered. So before my hearing loss, I wouldn't have known that background noise makes things more difficult. I wouldn't have known that people with single-sided deafness can't identify where sound is coming from. So all these things I talked to him about, and the emotional impact as well. So I lost a lot of confidence at the beginning, and I talked to my partner about that. So my partner was one thing that helped me. So I definitely would recommend that people speak to their loved ones if it feels right, if it feels natural, to tell them how they're feeling. Other things, generally being open about my hearing loss. And I still do this to this day. When I meet somebody, one of the first things I say is, oh yeah, I don't hear very well out of this ear, or I don't hear too well, or just to make them aware. And I know not everybody tackles life like that with hearing loss, and some people maybe feel a little bit more reserved. But for me, it's just easier, and it saves me a lot of embarrassment. It's more embarrassing for me to just stand there and not know what somebody's saying than for me to just tell them I can't hear well, so I might have to ask you to repeat. So being open about my hearing loss helped a lot. And then just a lot of trial and error. So at the beginning of my hearing loss, I had sound sensitivity, so noise sensitivity. It was difficult for me to be in a cafe with noise. It was difficult for me to be outside with all the car noise. But it was just a lot of trial and error. I'd go out just for a little bit of time and I'd put myself in these uncomfortable noises. I'd try and listen to people, and then I'd go home. And then the next day I'll do it a little bit more. And the more and more I got used to it. So with time, it just, like I said, it's normal now, but it took time, it took perseverance, and trial and error.
Yeah. I think it's great, in terms of what you do, in terms of the coaching and the counseling aspect of things. And I think this is part of why we're doing this. I just think that there is more of a focus within hearing health care and audiology in general about the technology, the hearing aids, the implants, but we both know that that's not the only solution. There's the portion of the therapy, the rehabilitation, the counseling aspect. So it's great that I'm sure when people meet you and have that opportunity to talk to you about the counseling aspect, that you've gone through this and you can kind of give them your firsthand experience and some of those things like advocacy for yourself and modifying your environment and trying to focus on what's going to get you to your goal of conversing with who you want to converse and trying to reduce the background noise and all of that, and adapting little by little, taking on a new skill set each day. That's like the foundation of hearing rehab or oral rehab or hearing therapy. So the fact that you're able to give that to those that you counsel as a firsthand experience and how it worked for you, and allowing them to modify it into their or adapt it into their lifestyle is huge. And I think that's the biggest portion of what is missing in hearing healthcare in terms of that the patient advocacy, and then working towards the emotional part of it and how to get through that, and not just going to the hearing healthcare provider and just putting a hearing aid on it or putting an implant on it. I think it's really great how you've gone through doing the therapeutic portion of it first, and then coming to the point where you're at acceptance and you're like, let's see what other solutions I can do. I've taken myself to this point. What is the next step in terms of improving my hearing journey? So I think that's really important, and that's great that those who have your support can get that from you, get that experience from you.
Exactly. The reason I started the coaching is just from connecting with people through my Facebook support group and my blog, and just realizing that although audiologists are doing this amazing job of bringing technology to our ears and helping us hear again, there's that moment where you either have your technology or you've been told that technology won't work. And then you walk out the door of the audiologist's office, and then you're on your own. So you're either on your own to get used to living with hearing loss without any kind of technology, which is one thing, or with the technology, which is another thing. And then dealing with the emotions that come with that as well. So maybe you've had a lack of confidence. Maybe your hearing aids give you a boost of confidence, which is even better. Maybe you're struggling in social environments. Maybe you're not sure how you can adapt your work situation. You have all these questions, and it's kind of, you've had this brilliant experience, hopefully, with an audiologist. You've got this technology, or you've got a plan. But then it's, well, what do I do now? How do I do this? I'm on my own. And that feeling is just, most people I speak to have that feeling of being alone in this. However many people you tell about it, you're still there in your own skin living with this. And you can't, unfortunately, take the audiologist and put them in your pocket and ask them to come with you, in your day-to-day life to help you with these things. You are, dealing with the practical and emotional issues on your own. And I think speaking about them to people who really understand what you've gone through, and to try and work on the goals that you have, whether it's advocacy or, developing self-confidence or thinking about work accommodations. I mean, it can be so helpful, and just organizing your thoughts on those issues as well, because I don't know when you had to hearing loss, Ruth, but for me, I had so many thoughts going through my head about, well, I thought, later in my career, I'd be doing this, or I thought that when I'm older, I'll be doing this. And all those plans that you initially had actually are probably going to be a little bit different now. And when you think of that situation, it can really help just to speak to somebody, firstly, about these thoughts, and then to put them in order. And then think, right, where am I going to go with this now? Make a plan. And that's basically what I'm doing, just helping people make a plan and make progress.
That's nice. That's great. And I think it's similar to how urban hearing started. So we don't primarily focus on technology at all. We work predominantly actually with patients who have normal hearing and have difficulty processing auditory information. So it's auditory processing challenges. This comes in the most people think it happens in children or children that have ear infections, but it really shows up in adulthood as well if either it wasn't treated as a child or as time goes on, things like dementia can result in auditory processing disorders, head trauma, strokes, things of those nature. The majority of the patients that actually we work with are those that probably suffered through childhood with these challenges. And it's really interesting. We just had this one patient who told us that it changed her life. She's actually a recovering alcoholic. And she said that she believes that she drank so much to just avoid the awkwardness in social settings because she couldn't communicate. So she felt like, if she was drinking or if she had alcohol, that just kind of offset or made it acceptable that she wasn't connecting in conversations in social settings. And when she went through the therapy and all of a sudden had a breakthrough, which typically happens around like 7 or 8 weeks during the therapy, she's like, if I would have gone through this, in my early adulthood, older teens, I would have completely avoided all of the challenges that I experienced with my alcoholism, because I can realize now that I was just struggling with an auditory processing disorder. I wasn't hearing what they were saying, even though my hearing is normal. And I was using the alcohol as a way to compensate in that environment to feel less awkward and feel less comfortable. And as a young teen and a young adult, you don't want to avoid those social situations. Like, your life kind of depends on it. I remember like saying that, your social life was everything. And that really dictated your success, so to speak, in life at that point, at that stage in life. So it was really, really, things like that are just so affirming, I'm sure, in what I do, and I'm sure in what you do as well.
It just shows how life-changing, not just hearing loss is, but like you said, auditory processing disorders. So when you actually struggle to communicate, it just shows how life-changing it can be. Yeah.
Well, I think this is a great point, and I think we've reached our pinnacle here to kind of what our platform is, and I look forward to delving into all these topics further. And I think definitely, Carly, you have so much to contribute in this area. And I hope that we'll have some additional people coming on, and we'll be able to ask them some questions and just shed light on various, as we said, hearing disorders, not just hearing loss itself, but the tinnitus, the balance, the auditory processing disorders, the discomfort that comes along with it, and really try to focus on that emotional aspect and that social emotional aspect.
Sounds great. And looking forward to more from you too, Ruth.
Thank you, Carly. Have a great one.
You too. Bye.